Okay, so it's also important for us to know that the action potential of contractile cardiac muscle cells, it shows a characteristic plateau. Okay, so from the entry of sodium, okay, and of course, towards the decline of the sodium concentration, okay, and of course the fast efflux of potassium, okay, and there we have here a plateau phase of the action potential caused by the presence of calcium, release of calcium in slow manner via the long-lasting channel. Okay, and afterwards, after 250 milliseconds, okay, or the plateau phase, of course, potassium will go out fast of the cell, and this would lead to repolarization. Okay? So, the action potential in cardiac contractile cells, it differs considerably from the action potential in cardiac autorhythmic cells, So, the rapid rising phase of the action potential in the contractile cells is the result of the sodium entry on opening of the fast sodium channels at threshold. So, the early brief repolarization after the potential reaches its peak is because the limited potassium efflux on opening of the transient potassium channels. And this will be coupled with inactivation of the sodium channels. So the prolonged plateau phase is the result of slow calcium entry on opening of the L-type calcium channels, coupled with reduced potassium efflux on closure at several types of potassium channels. So the rapid failing, phase is the result of the potassium efflux on opening of ordinary voltage-gated potassium channels, as in other excitable cells. So the resting potential is maintained by opening of the leaky potassium channels. It is also important to note that the cardiac muscle has long refractory period, which prevents tetanus. So in figure 9-25, we have here the relationship of the action potential and the refractory period to the duration of the contractile response in cardiac muscle. So this is important to know, because once that there is a very short refractory period, it means to say that the contractile cells could undergo tetanus, and we don't want that to happen. Tetanus is when there is another action potential or there's another contraction even though there is an ongoing contraction. Okay? So with this very long refractory period, it would ensure that the heart will beat in a strict interval, and this would prevent the heart from undergoing tetanus. Okay, so now let's proceed with the ECG, or electrocardiogram, or we can also call it EKG. So the ECG is the recording of electrical currents or electrical activity which is induced by body fluids by the cardiac impulse that reaches the body surface, which is detected by recording electrodes on the skin, like for example the limbs and or the chest. So the ECG or EKG is a complex recording representing the sum of electrical activity spreading throughout all of the hearts and muscle cells during depolarization. So ECG is not a recording of the actual electrical activity of the heart, but rather it is just a representation. So the ECG is generated by the cardiac muscle during depolarization and repolarization, and it's spread into the tissues surrounding the heart and that are conducted into the body fluids. So the normal vertebrate ECG exhibits three distinct waves. So we have the P wave, the P wave, and then we have here, which is represented by atrial depolarization. And then we also have here the QRS P wave, and then the QRS complex, which is associated with ventricular depolarization. And then we have the T wave, which is represented by ventricular repolarization. So the ECG baseline is the PR segment, PR segment, this one and here, okay, which is associated with AV nodal delay. Okay, so what we can see here, we cannot see any peak in electrical activity because this is where in the AV nodal delay there will be no recorded electrical activity. Nah? So we also have here the ST segment, okay, OPQRST segment, ST segment, okay, which is the plateau phase of action potential of cardiac contractile cells. Okay, again here there is no change in electrical activity, and then we also have here the T and P interval. Okay, so for example here this one and here, okay, which is an indication when the heart is completely at rest. So why do we need to measure the ECG or the electrocardiogram? Okay, because this is conducted on humans and animals to diagnose heart problems. So for example, when there's a P wave with no subsequent QRST events, there is a skip beat, or it's also called AV block, no? Or it means that there's a damage of the conduction fibers. Okay, and of course, more importantly, ECG measurements or checking out your ECG or the ECG of the animal is a part of physiological monitoring during studies of behavior. Okay, so for example, when we're checking on the behavior and certain behavior of an animal, if it is being associated with this type of food or this type of stimulus, no? And also the effects of temperature, then drugs, stress, and exercise to the heart conductivity of the animal. So this is in the SA node, or the contraction or the electrical activity going on from the SA node to the right atrium, okay, is actually characterized by the P wave. Okay, and next from the AV node, okay, to the bundle of His, okay, there will be a characteristic plateau, okay, or in the internodal area, no? And then of course afterwards there will be a characteristic plateau, and of course there will be the R, okay, sharp turn in R, and then of course S complex, and then we have here another mound here for the T. Okay, so this is actually the standard bipolar limb leads. No, we have lead number 1, number 2, and 3. Okay, and this is the respective or positioning. Okay, when you're going to use this in getting the ECG of your animal. Okay, so the connection between the recording electrodes, they are made internally in the ECG machine by turning a switch. Okay, so this is using an animal to do it. Okay, and then we also have here an example of a normal sinus rhythm. Okay, so we have here, if you can, we can see the P wave followed by the QRS complex, and then of course it's followed by the T wave. Okay, this is the normal sinus rhythm. How about when there's sinus bradycardia, or there's slow heartbeat? Okay, so for example, this is an example of a slow heartbeat. There is no regular interval, one heartbeat, second one, and then of course it will be followed by a very, very long plateau, and of course, or flat line, and then it will be followed by another one. Okay? When we say sinus tachycardia, okay, there is an irregular, or there is a faster than regular or normal sinus rhythm. Okay? So this one, okay, one PQRS T complex, another one, no? Okay, another one, and so on and so forth. Okay? So we also have here an example of a premature atrial complexes and a ventricular complex. Okay, so we have here a premature atrial complexes. So for example, parang anino, it's very, very taas kayo siya. Okay? And then, of course, we have here one, and then, pak, pak. Okay? And then, we have here a premature ventricular complex. Okay? So, this is shorter than normal. Okay? And that represents the premature ventricular complex. Another is, we have here an AV block or first degree AV block. So when you say first degree AV block, as you can see, ang QRS complex is not well defined. Okay? Okay, so for example, kini wala gyud siya. Okay? And then of course, we have a secondary AV block. Okay, so dinhi medyo dali pa. Medyo compared to normal, okay pa. But in the second degree AV block, you can see the problem here. And then of course, in the third degree AV block, okay, dako na kayong problema niya. Okay, wala na yung nagsunod na QRS complex sa kada P wave. Okay? Okay, so kini nga P wave, wala na nagsunod na QRS, and here wala na. Sa tanan, almost sa tanan nga P wave. So we also have here an example of a supraventricular tachycardia. So tachycardia means a rise or a faster heartbeat, no? So as you can see here, one P wave followed by, wala na, dili na modified kaayo ang PQRS, wala na gani ang T wave. And then balik-balik na. Meaning to say, because of the fast beating of the heart, the repolarization of the ventricles cannot be heard, no, or the activity is superimposed by the activity of the depolarization of the ventricular muscles. And then we also have here ventricular tachycardia as well. So the ventricular tachycardia, murag wa na gyud kay mahibaw, nabali na siya. Okay? Nabali na. So, during ventricular tachycardia, the QRS complexes are inverted in polarity. Now, bali na siya. Okay? And prolonged in duration. Bali na siya. So, during supraventricular tachycardia, the QRS complex remain upright and narrow, indicating that the ventricular activation sequence is normal. But during ventricular tachycardia, the QRS complex are now inverted. Okay, and then we also have here an example of atrial fibrillation. So, makikita na kayo mo ani sa monitor sa ECG sa inyong mga patients, no? So, this is what an atrial fibrillation in cats would look like. And we have here the ventricular fibrillation in dog, okay, would look like. Okay, so that ends our topic for the morphology, automaticity, and rhythmicity of the heart, together with the ECG, which is very short, no? And for the next topic, we will deal with cardiac cycle and normal heart sounds. And of course, I'm so sorry if nadali ni nga discussion, because I really wanted us to cover all the topics for the final examination. So again, guys, wherever you are right now, keep dry and stay safe always. Okay, bye. Happy weekend, everyone.